Congressman John Tierney, who is a 6th District member representing Massachusetts' 6th District. He has developed a national reputation as an effective legislator fighting for America's working families. John is also a member of our subcommittee.
Well, thank you, Mr. Chairman, and thank all of my colleagues for giving us the opportunity to talk with you here today. When I first got elected in 1996, in my 30-odd years here in Congress, but in 1996, I advocated for universal health care, but in a single-payer form. And there was a big raging debate at that time, and it continued for a while, but it was clear after a while that that was a big ship to turn around. To try to get everybody moving in the same direction. There were others that advocated as passionately for different ways, but little disagreement about the fact that everybody wanted universal coverage, every American covered with quality, comprehensive, affordable health care. The concept came to the idea that maybe we could do it in the way that's been outlined by my colleagues here. Obviously, I wasn't the first to have that idea, and it was good to not only start working with them and Mr. Beaupre, who's now moved on from Congress, but with people from the National Governors Association, Stu Butler, Henry Aarons, a whole group of people who were interested in trying to put this together and getting some momentum behind it. I won't go into the details of the plan. My written testimony has that, but you've already heard that from my colleagues. But I do want to address the issue of ERISA and waivers on that. I think that's critical. If we're going to have any movement of a system that allows states to really get creative and to make some new ideas work, then they've got to have the ability to waive a number of federal regulations and laws, and most notably ERISA. So I would encourage everybody to look at that issue and be inclined to look at it with favor. It's timely given the fact that Maryland's Fair Share Health Care Fund Act was based on an ERISA preemption, and that's the same with a lot of different states that have to move in that direction. Let me just mention a little bit about what Massachusetts did. I know the chairman had asked that we touch on that in the testimony. Massachusetts enacted legislation that I would say is near universal in its reach out. We did that by expanding S-CHIP to a certain degree, by merging the state's non-group and small group health insurance markets, by creating a public entity known as the Commonwealth Health Insurance Connector to, in essence, if you will, connect individuals and small businesses with affordable quality health insurance plans. It's all very innovative in that sense, but we had some efforts to go to reach consensus on that. The fact of the matter is that employers, we hope and encourage them to continue covering people, but if they don't, they're going to have to pay an annual sum per employee of $295. Now, that's the provision that Governor Romney vetoed before he went out and took credit for the bill. But the fact of the matter is that there has to be some mechanism there to encourage employers to cover people or to participate in putting money into a fund that can then be used to subsidize individuals who can't afford a policy. So the connector group creates policies that are affordable. We subsidize people into certain income categories, and then others have to pay on an as-can-afford basis on that. There's still going to be about 60,000 people, it's estimated, that will fall in the cracks. And they may well be people that are self-employed, working at home from websites. My office has been working lately actively with state officials, with a group called the Freelancers Group, another group, Creative Economy Association of the North Shore where I live, to try and find a way to have either the connector group allow itself to create a policy for them, or to allow these groups to create a policy which they can afford, so that people that are self-employed and create so much a part of our economy now, probably in all of our districts, also have access to that. It's a crucial step, I think, and probably the only way that we're going to move forward is to allow a number of different models to be put forth. As Tom Price said, probably going to be the situation where urban communities are different than rural communities, different parts of the country differ on that, but we need a series of models or pilots that we can then see what works and take up the scale. I think this bill allows us to move in that direction. I was pleased and honored to work with my colleagues on this. If the three of us can work together, then probably anybody with varying and disparate views can work together, because we had a lot of room between where we were on this. So I thank you, Mr. Chairman. I thank my colleagues again for allowing us to put this measure before you for consideration, and look forward to working with all of you on it. Thank you.